See how, y'all, I'm not moving that towel? See how it doesn't even get close to my shirt? Like, I'm literally squeezing, oh, I would be if I was wet. And I'm just, that towel never gets close to me because I work my arm through the towel. Thank you, ma'am. And always pinch from above. Guess I was a little premature. All right, while she's doing that, I'm gonna move forward and start to glove. No wasting time. I'll just take my time gloving. Go ahead. Make sure, I notice a lot of you aren't standing back, so step back after you pick up your item.
Okay, these are gonna be new for you guys to open. You're gonna fill them out, reach in and grab them out of the pack. These are folded the same way as the gown and towel packs and stuff. You're always gonna hold it where you open it away from you first. So you wanna make sure that you're holding it in your hand, you've got a good hold of it so it doesn't flop around. Pull the tab. You wanna make sure you're covering your hand when you toss the stuff, because sometimes people may come up and take it directly from your hand, and if your hand's covered, you won't contaminate them if they kind of snatch and grab real quick. Open the other side. You want to make sure that you're rotating this so your hand doesn't reach over the top of the sterile items whenever you're opening this stuff. This last flap, you want to grab it. Be careful reaching back there and everything because all that stuff's sterile, so make sure you're away. My hand's completely covered. And then I'm going to just toss it onto the field like that.
And secure those flaps, because if you let go of one of those flaps, it can brush against your sterile field.
These lap sponges are open the same way. You just kind of tear this, but you're going to have to roll it in your hand one time before it's ready for you to start opening. Did you turn a little? This way. Last one. My hand's completely covered and I'm holding all the flaps, and then I'm just going to toss it and it went to the floor. So what would I do? I have to go get a new. Nothing's coming out. Count sheet will go in the circulator. Check my locks. Dates. Roll, at my indicator, and checking filters.
Did y'all see how I pulled that off? Some of you are letting this string fall. Hold that whole string. And I'm gonna move out of her way so she's not creeping all the way back by that sink. All right, here we go. Does this field have to stay sterile? You need to go this way. Does this field need to stay sterile?
Yes.
No. Can I pick it up and throw it away? No. Okay. All right, so I'm sterile. Here's where it changes, change gears. I can touch these, okay? I want to stay close. I'm gonna look at my indicator, it's changed. Go ahead and pick up your towels. And I'm gonna set them right here. And I wanna make sure I have room for my instruments. And look at how I'm stepping, y'all. See how I'm walking where I'm facing my fields? And I'm gonna come out like this.
And she's staying close to her fields the whole time.
Because this is what y'all want to do. What's wrong with that? Correct. So, I'm sidestepping my way out. I'm watching the front of my gown because the outside of this box is not sterile. I see the indicator. I'm gonna pass that off to her. I'm above her. Okay, I'm gonna reach in. I don't see anything wet or anything. So I'm gonna grab these and I'm gonna move out of her way, but yet I'm not over my field.
I'm checking for holes and they're good.
All right, upper left-hand corner. Now what do I wanna grab? Table cover. Okay, I'm gonna come over here and I'm just gonna cover that up. So I'm gonna set this table cover down, let it fall over the edge. Okay, you wanna cover the front of your table first. In the OR, you're not gonna have this. They did away with these. So you're literally putting this on a metal table. So you want to be back so you don't rub up against that. and hence why you cover the front first, okay? So I'm gonna hold it in place because it'll be slippery. And I'm just gonna open it up. Can my fingers cross over the edge?
Nope.
That's a break, right? Okay, then I'm just gonna work my way down. Try not to move the table cover. All right, and same thing with the back. And notice how far I am away from the wall, so I'm not touching it. Okay, you want it smooth because they're gonna put pans of instruments and things on here. All right, so now I'm gonna come over here and I'm gonna gather up the drapes, the gowns, and y'all, we're not gonna use these blue towels in here, so they would use these in the OR, but after we open your pack the first time, we're just gonna get rid of them. And y'all can take them home. So I'm gonna gather up all of my drapes, my gowns, and then all of these towels except 4. I wanna leave 4 of these green towels over here. You'll see why. All right, and let's see, doctor's gloves are right there. So I'm gonna load all this up and carry it over here and set it down. Do I wanna arrange this?
No.
No, last, right? All right, so now I'm gonna come back. Let me put things where they go, which you'll know according to your diagram. Why move things 2 and 3 times, right? Try to get all this trash off my field, the things that I don't need. So I'm gonna pass that to her without turning my back to my field. All right, and I said, what do you arrange first?
Instruments.
Instruments. All right, so I'm gonna take a green towel. I'm gonna fold it in half widthwise, and then I'm gonna fold it in half this direction. That way I can make a nice tight towel for my long instruments. All right, y'all, and I'm just gonna start unpacking everything. You guys packed these, so now you're gonna unpack it. So I'm gonna use my foam rack for my instruments here. My long instruments, always remember, like I told you before, the curves are gonna go to the right. The point's away from you. You guys will be able to come take a picture of this at the end. As you take these instruments out and put them where they go ahead and take the stringers off. Those stringers can go behind this instrument panel. All right, so on the count sheet, do y'all remember which instruments are all the way to the left? Which instruments do you start counting when you do the rack? Cokers. Very good. So the rack with the cokers is going to go all the way to the left with the curves facing the right. So now you guys are actually taking the stringers off the instruments. You want to be careful you don't snag your glove and put a hole in it. All right, and I'm going to utilize the space on my table wisely. Stick those behind. I should not have just touched my face, but I can't breathe and talk. Total break and sterile technique. All right, so your towel clips are go to the end of your instrument pan here with the curves facing in. And again, this is according to your diagram. This is all laid out on your diagram, so be familiar with it. You're gonna stack these hemoclip pliers on top of each other, the like ones, but y'all make sure the tips are pointing up. If you do them face down, it could poke a hole in your table. Knife handles all go right here. And then I'm just gonna take my retractor tool out. Now, if the workroom people stack this the way they should nicely, look at that. There's all my DeBakey's, and they're gonna go right there. Instead of picking each individual one. And for you guys, it's gonna be, did your peers put it back nicely? Remember when you guys assembled it? Then your pickups with teeth, you can kind of spread those out when you get them out of the pan. I'm gonna leave my 2 malleables right there since that's where they're gonna live. And then I'm gonna, can I hang these instruments over the back of that basket? No. Yes, I can. But can I have my handles sticking out past the table?
No.
No. So those can hang over the edge of the basket, but things with handles, I'm gonna put this direction. And I'm stacking like things together. It's gonna help when Angie and I go to count. But as a scrub, when I'm working and passing to the doctor, that's easy to grab in hand. And then I'm gonna make sure these aren't screwed together and just set those right in the handle of the instruments. All right, instruments are assembled. Angie's gonna make that sterile for me, magically. All right, so I'm gonna put this in here. And y'all, why am I putting that close to the edge?
So she can pour it without.
So she can pour without reaching over. I wanna put the asepto down in the bowl. If I put it in there as she goes to pour, it's probably gonna fall out on the floor. So now she has something to do.
The 0.9% sodium chloride, it expires August 2021, and this date is August 30th.
Okay, is it important that I verify that?
Yes.
Absolutely. All right, so now I'm gonna fold a towel in half this direction and I'm gonna lay it right here, as far over as I can get it. My medicine cups towards the edge of the table. Again, in the event that she wants to pour me meds and I'm busy, she can pour them without reaching over my field. The lids are gonna be beside it. You guys are gonna have labels and a marking pen. You can put those next to your medicine cups in case you have something to label. We're gonna take out one of your foam things and throw it away. This is your sharps box for your needles and blades. That's gonna sit right here on the towel. You guys are gonna have a bag that's gonna be a trash bag for you. In the OR, you'll peel it off and stick it, but we're just gonna slide it up under the green towel. Now, if I drop something in that garbage bag, can I reach down in it in the middle of the case?
No.
Mainly what we're gonna drop in there is gonna be like your suture packets. That way, if there's a miscount at the end, the circular is gonna come and they're gonna get this bag off my field and they're gonna count packs. If we have a discrepancy in counts, we need to go back and count the packs and make sure we didn't, write something down wrong. All right, laps are gonna go in here in the big bowl. Raytex go in the small bowl beside it. Notice how I'm pushing everything to the corner. Extra towels here. I'm gonna lay all my suture out on this green towel. Why do you think I made this green towel? Why do you think this is here? If all my sutures on here,
So you can see don't pour someone's
strike through, yeah. To put all my sharps on, absolutely. These are the light handle covers. Okay, these, we don't have lights, but these are your light handle covers. So this is my Bovie, which y'all in the OR, you're just gonna come like this in a bag because it's so awkward that I'm just gonna pull it out of this bag though and pass this trash off to Angie because I don't need this trash. I don't want any trash on my field that could get pulled into the patient's room. All right, so now I tell her that I'm ready to count. What do we start counting first?
Your laps.
Supplies. I'm here, right? All right, so who leads the count? All right, here I am.
Laps.
Laps. So y'all can just pull your tapes off and in the OR we throw them away, but I just tuck it back there.
And over here, I'm writing the sponge count and everything.
1, 2, 3, 4, 5. Well, that one ripped. 6, 7, 8, 9, 10. 2 different stacks, right? Because if one's wrong, what are we gonna do with it? Get it out of the room.
You notice too how she didn't let the tails of her laps fall over the front edge of the table and stuff like that. She pushed everything back. All right, Raytech.
Raytex, and you're fully separating them. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10.
You also see how I'm away from the field. I'm not standing close to her field. Needles.
Needles, I'm gonna start with, I have more than one, that's a multi-pack, right? So I'm gonna start with it first. Okay, I've got 1, 2, 3, 4, 5, 6, 7, 8. Ties don't have a needle, 9.
Blade I have in my pocket.
One. This is magnet, you can put it on that magnet side.
Cautery tip
Cautery tip, you're gonna need to pull it out and show it to her. I've got one.
and injectable.
And I've got one injectable needle.
And I told y'all you may have all that other accessory stuff that you've got to count and everything. So you'll just kind of keep going down the list. Alright, retractors, let's do the ribbons.
Okay, y'all, when I count this is what you guys are gonna wanna do. That's normal. Grab onto your gown with your left hand so she can see, and that way it keeps you from dropping your hand. And then use your right hand to point. A lot of people use like a knife handle to point, I just use my finger. But it doesn't matter, whatever you choose.
And like those ribbons, I can see through the front of the basket,
Yeah.
so I shouldn't have to move to
So
count.
I have 1, 2. And she needs to watch that as a sterile field, correct?
Yeah.
So when she's counting, she wants to stay away from that.
Beavers,
Beavers, I have 1, 2, 3. Y'all make sure you're touching the item. If you're just going 1, 2, 3, how do we know what you're counting?
and y'all may have a newer nurse that really doesn't know the name of these retractors sometimes too. Let's see, Harrington,
1,
Richardson's,
1, 2, 3,
Eastman,
1,
sorry, excuse me, Army Navy,
1, 2,
Sharp Brakes.
1, 2,
Alright, let's go to your pickups, Bonnie.
1, Bonnie,
Alright, your pickups with teeth,
1,
DeBakey,
1, 2, 3, 4, 5, 6. See, I'm not leaning and I'm not picking them up. I'm just touching them and pointing them to them.
Edson's.
That's and I have 1, 2,
Alright, let's do abdominal suction and guard.
1,
Knife handles.
1 long, 1 2 short, and 1 safety.
Alright, on the stringer, your long instruments,
Okay,
ring forceps,
1, 2,
needle holder,
1, 2, 3,
mitts,
1,
your curved pokers,
1, 2,
Kelly's,
1, 2,
tonsils,
1, 2,
right angles,
1, 2,
and bow plants.
1 straight, 1 curved.
Alright, on the rack, straight cokers,
1, 2, 3, 4,
curved cokers,
1, 2, 3, 4,
Alice,
1, 2, 3, 4, 5, 6,
long Alice,
1, 2,
Babcock,
1, 2,
tonsil,
1, 2,
right
1,
angles,
2,
your peons,
1, 2, 3, 4, 5, 6,
and your hemostats.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Alright, needle holders,
1, 2 short, 1, 2 medium, 1, 2 long.
scissors, let's do long curved mayo,
1 long curved Mayo,
short mayo,
1 short curved,
straight mayo,
1,
long mitts,
1,
and short mitt.
1.
Okay, towel clips,
I have
large biting,
1, 2, 3, 4 biting,
non-biting,
1, 2.
hemoclipper pliers.
1, 2 large, 1, 2 medium.
Okay, so now we're finished counting, so since we're finished counting, I'm gonna go over here and write the sponge count and stuff on the whiteboard.
Y'all, look what I'm doing. I'm here. Why bounce around? I'm gonna reach over with my left hand because I'm not crossing over, right? And I'm still facing my field. I'm gonna feel my septo. Squeeze, dip. Let it go. Squeeze, dip. And one last time. And again, don't let it squirt the ceiling. See the water go up? And then just leave it. Do we label that?
No.
Yes, and the O or anything liquid on your field, you have to label. That is a yes. All right, so I'm done with this field, I'm done with this field. What am I moving to?
Mayo stand? Mayo
The
stand.
Mayo stand, right? So I brought the cover over here. So I have all this empty workspace. Y'all, this Mayo cover is a little bit tricky at first. Find out how to do it. So you're gonna find the wording, lay it out on your table, all right? It says left hand, right hand. This is fan folded in here. So when I go in at this, I want my hands to be like this, and I'm gonna grab it like this on the sides, inside, so I can hold those layers so it doesn't come open. And then at the end, I'm gonna do this with my finger and thumb to open them out, okay? So when you put your hands in here, they look just like they did on the outside, and I'm opening that mouth wide open so it can fit over the end of that Mayo stand, okay? Don't turn your back to your field. If that's way back in there, reach in, get it, and pull it out. Because can I do that?
Yeah.
My hands are covered, right? Step on it or else it'll dance away from you. Push this on, and as you start to advance it, you're gonna have to unfold it. If you're short, be careful, you don't want it near your face. Okay, so just keep your hand secured, work it on. And as you undo it, don't let it fall below waist level. Okay, slide it all the way on. Take the excess to one side. This tray lifts up and tuck it in between. If you have a bunch of saggy corners, just like your fingers of your gloves, if they're not fitting tight like this, sharps are gonna catch on things and put holes in it. So you want your gloves to fit tight, you want your corners to be tucked. How many towels go on here?
4,
Nope.
2.
Yep. All right, so I'm gonna use these towels. That was a good guess. 4 left over there. You had a 4. All right, so I'm gonna use these towels over here because I wanna keep those. And I'm gonna open these. Do I do this?
No.
No. Do I watch for that?
Yes.
Because what would you do if it landed like that?
Go ahead and throw it off the table.
Yep, so you wanna be up here on your table where nothing's over the edge. Take 2 towels and lay them where one of the ends is even with each other. None of these towels are the same size. Okay, and then you're gonna wanna pick it up so it doesn't go below waist level. And the side I lined up, I'm gonna put towards the front of my mayo, and I'm gonna line it up with the front of my mayo. Reach back here, barely give that a little tuck in. All right, I'm gonna fold them both back. What goes on the very bottom?
Your tie.
Yep. So my silk ties, I'm gonna tear these. Now y'all, some of this stuff, after you and your partner each practice, we're gonna leave in your pack so we don't open this stuff every time. So on your silk ties, in the OR, we're gonna pull them all the way out and lay them here. We don't wanna do that here. Just pull some out and let it hang over, okay? So by lining my towel up with it, I can see them. If my towel would've hung over, I wouldn't be able to see those to pass them. Trash, I can put in that little trash bag if I want. All right, next layer is gonna contain what?
Straight man.
All right, first we need a scalpel. We need 2 pairs of pickups, right? Do I want 2 different sizes?
Yes.
No,
Same.
I want 2 the same length. 2 DeBakey's. We need the suture scissors. We need the Mets and Balms, and what are 2 things I said if they get into a bleeder?
Well,
Yep, 2 hemostats. So anything that has a ratchet, we're gonna click it or tick it. Click it before you put it up. All right, gather all that up at once. We're not putting the scalpel on the handle yet. All right, so first thing they're gonna do is cut skin. So I'm gonna have that here first. Then they're gonna wanna pick up the tissue. So I'm gonna put my pickups beside each other. Don't tuck them in together because I had a bad experience. Mets and Balms, Mayo scissors. Alternate the handles, it'll save room. Stack your 2 clicked hemostats on top of each other back here. Now, in the event we get in there and I need to add things to my Mayo, look at all this room I have. Because I'm stacking things nicely, okay? And they're in order, so I don't have to think about it. No, one time I put these together and it was the meanest doctor ever at Children's Hospital, and he asked for a pair of pickups. Now at Children's, let me just tell you, you know, the baby's little. Well, you got med students and residents and blah, blah, blah. So I was like down here. So he was way up there. So he asked me for a pickup, and I did this, and I went to give it to him, and that one went flying through the air, and I was like, son of a, you know, I'm thinking this. Well, his resident across like grabbed it. And it's like, whew. So ever since then, I don't stack them together because that was scary. I just knew I was about to get killed. All right, so cover up that. What goes on top of this? Suction. What goes with the suction tubing? Yep, without the guard or with?
with
All
that.
right, so go ahead and put that on. Y'all, this end that has the little ridges, that's what goes into the suction tubing. You don't have to shove it to China. Just get it in there real good. I said we're gonna use a short Alice. Some people use the non-penetrating towel clips, but I'm gonna use that to connect my cords to the drape. Do I need my Bovie?
Yep.
What about this fancy schmancy cup it comes in?
Nah. Yeah.
Yes, we're gonna put that on the drape. That's why it comes with it, so that we don't burn the patient. All right, does this have to be in any order? Absolutely not. All right, do I need these? What are these? Glide handles. Well, do I need them?
Yep.
And what else? There's 2 other things. Same thing, but 2 of them. Lap sponges, that's right. And just set those up there. Complete, complete, complete. I still have a few minutes. So, We're gonna do the drape table, right? All right, I'm gonna come over here, get all my drapes, move my gowns. So, the very last thing I'm gonna drape with is the chest breast sheet. There's a picture of a little guy on here. I don't know if you can see him very well. My patient is lying like that, head there. I'm gonna lay my little man the same way. So when I'm a nervous wreck, after I've gown and gloved the doc and he wants that drape, I don't give it to him upside down, right? I took the thought process out. So I'm gonna need that. I'm gonna need this blue drape, and I'm gonna need 4 cuff towels on top, and I forgot my towel clips. So I'm gonna make another trip. All right, you're gonna take these, they're folded with cuffs. Again, don't shake these because you don't wanna create dust. You're gonna fold them like this with the cuff out, and you're gonna do 4 of them because we square off the surgical site. Lay them all the same direction. Don't try to get fancy and flip one the other way. Y'all don't know enough to do that. So do 4 of them that way. That's all gonna be for draping. Extra towels, just set beside it if you need them. Put your gowns right here. Actually, no, we need a folded towel. Put the gloves here. All right, actually, we're gonna do 1 towel for the surgeon. Someone asked, do we give him the paper towel? No, we give him a cloth towel, which will be the blue ones. So you're gonna go ahead and open it up the whole way. Hamburger, hot dog it, whatever y'all call that. Lay that on top of the gown because they're gonna need to dry before we gown them, and then we'll glove them. But I should have, when I came over earlier, brought my 4 towel clips, so now I have to make a trip back, get my 4 penetrating towel clamps, set those on top of the drapes, which we'll explain why later. All right, at this point, your instructor's gonna ask you if you're done. That's 40 minutes. From the time you start your 6-minute scrub to right now, 40 minutes. Not bad, right?
No, it feels like you did it in like 15. It says
Well,
33 on my thing, and I started right when she started. So.
All right, y'all feel free to come. You can stop recording now.